My name is Noelle Ebel. I'm a clinical assistant professor at Stanford University, where I'm also the director of the Alagille syndrome program. When you look at within the United States how patients come to care with Alagille syndrome, they have a lot of different pathways, and some of it, as you can imagine, for a patient with a rare disease is a really long journey to the recognition of what the condition is that they have if they're presenting in multiple different ways, from heart to liver only to kidney only, or some combination of the three. So I think sometimes, similar to other rare conditions, they have this long journey to get to the specialist they need, which in my case is a hepatologist. I think we work with a really unique model in the sense that there's a number of institutions that take amazing care of patients with Alagille syndrome in North America, but patients don't always live near that area. And so for us, it's been a really fun experience to partner with local physicians who are gastroenterologists or cardiologists, for example, and even for providers outside of the country. And it's really fun to share cross knowledge, so they have an intimate knowledge of that patient and their experience. And then what we bring is sort of some things that we've developed over time as a multidisciplinary team. So not only thinking about the heart and the liver, but all the other organs that the Alagille syndrome touches. So I think, as a really long answer to that question, I think partnership is really key. We are still learning, and to me, that's really amazing. We already know what organ systems Alagille syndrome can touch, not necessarily for all patients, but we should have an identified subspecialist in each of those organ systems. So we have a neurosurgeon, a rheumatologist, a cardiologist, of course, a hepatologist, and a nephrologist. We wanted to have a specialist who already had a designated interest in Alagille syndrome that we could partner with. And it's been really meaningful. I think the value of having an individual in each organ system as part of a multidisciplinary care team is it really advances care, what feels like really quickly. You can imagine if you're seeing a rare syndrome, it would take longer to sort of catch some of these themes, to understand patients are having a higher likelihood of bleeding, or to understand the things we need to do before liver transplant. But when you have the same people all working together and thinking about them in the same way, then I think we've been able to advance a lot of techniques faster than we would have otherwise if we were sort of all spread out and not working as closely together. I really loved, not only in the space of Alagille syndrome, but other realms like pediatric liver transplantation, working with patient advocacy organizations. And really, it was almost a mentorship for me. So when again, we started with our Alagille syndrome program, we partnered strongly with the Alagille Alliance and other groups that are advocates, patient-based advocates and family advocates for children with Alagille syndrome, and cross-informs each other. So I love the patient and family voice because it's so distinct from the provider voice. And we really rely on patients and their families to say, not only to be advocates for their individual child, but to say, as a community, this is what's really important to us. And we'd like to see some of the research formed in that realm, or just have more exposure to experts in these fields. So for example, the Alagille Alliance hosts an annual symposium that very much has a huge patient and family voice. And that's so informative for us, for example, to hear we were invited to speak on, they just wanted to talk to a cardiologist. So thinking, up to 90% of children can have some cardiac anomaly who have Alagille syndrome. Families really wanted to learn more about that and to understand what could be the potential path of my child. So it goes not only to say, like, families just want more of this information, and can we help to provide that in a better way through webinars or more educational materials, or talking with other gastroenterologists or cardiologists across the country and figuring out a way how to bring that information directly to patients and their families. And then the last is, sometimes I hear things from advocacy groups for Alagille syndrome or from patients and families first before I'm hearing about it from my colleagues. So just hearing how excited families were to hear about some of these new medications coming out for itching for their child who had been suffering for so long really impressed upon me how important that was. As a provider, I should have that available as soon as it could be available to my patients. I think that voice plays a huge role in all of that. when I think about other organizations specific to Alagille syndrome or others that I'm a part of, there's this new shift to something called like a learning health network, but really, really ingrained in that is having a patient and family voice. And I think that's very, very much the future of medicine, not only when you're in the rare disease space, but you're just thinking about like, how am I taking care of a very specific population, is how much you need advocacy organizations and a distinct patient and family voice. So I think it'll change the lives of our patients. I think that's going to help do it at lightning speed. And it's really feels like a new thing that's happening that's really critically important in the rare disease space. Maybe the last thing I'll say is that coming up as a provider or physician, there's always this idea where people say, you know, what's your niche expertise? And there's so much pressure, I think, on a physician to say, like, what's the space that I want to operate in? What's the disease process that I'm most passionate about? And I have to say, very specific to advocacy organizations, that it's been such a pleasure to work in the space of Alagille syndrome. I think there's so many physicians, providers, patients, families, and advocacy groups that are and groups like yourself that are so really invested in rare diseases or this patients with Alagille syndrome. It's just really amazing to be in this space. So really grateful for the opportunity to talk more about it.